Welcome back to the In Chamber. I'm your host, Tom Schumann. As the last 9 months of 2020 wore on, many people became tired of the same old routines. For many, not all, work was home and home was work. Social interactions were limited. Hunkering down, quote, was a phrase we heard often from Governor Holcomb and others. And in other words, there was a lot more of the old than the new. But not for today's guest. She started a new job in July 2020, a job with nearly 5,000 Indiana-based associates as part of an organization serving more than 4 million members and operating in an industry that had to do its own reacting to the healthcare crisis of a lifetime. To me, it sounds like adding on to what could be already be a challenging situation, but also one that I'm sure is focused on opportunities. Beth Keyser, president of Anthem Blue Cross and Blue Shield of Indiana, welcome to the In Chamber.
Thank you, Tom. I'm excited to be here with you.
Well, Beth, I gave my brief thoughts on kind of what the potential challenges might be in starting a new important role about 10 months ago. Give us the reality a little bit. How have you been able to approach things operating in this somewhat of a unique environment?
Yeah, so I must say, I know all about what Southern hospitality is, but I didn't know anything about Hoosier hospitality. And now I can say firsthand, I can appreciate what that means and how that has helped me transition over the past 10 months. My coworkers, associates, businesses, and my community partners like you have been so warm and receptive. And as you know, I was excited to join Anthem because of the purpose to improve the health of humanity. This has been my life's work, and I felt like that purpose was really important in Indiana. And specifically, it's important because companies that are purpose-driven grow on an average of 3 times faster than their competitors. But more importantly, they have a lasting impact on the community that they serve. And so that's one of the reasons I wanted to be in Indiana. And then also, as a publicly traded company, we're obviously expected to grow, and achieving that growth requires that we motivate our 5,000 associates that you mentioned. And I believe as part of that motivation, it's critical for them to understand how they have purpose in everything that they do day in and day out. So I want to be sure that they understand 3 important words, and that is improving the health of humanity and what that means to their work and how it ties into their activities. And improving, obviously, is the relentless pursuit of progress and overcoming obstacles in their daily jobs. And then, of course, for health, transforming Anthem from just being a health insurance company to a health-focused company. And then humanity, that's that common thread, Tom, that binds everything we do in our community.
Well, Beth, we're going to get to even more detail on some of those great things you mentioned there. But one thing you said is that this has been your life's work. Talk about some of your experiences, a little bit of your background, some of the roles you've had before coming to Indiana.
Yeah, so I am the daughter of a nurse who went on to be a CNO of a hospital and a hospital administrator. And I was always exposed to the acute care of health. And instead, I knew I wanted to keep people well. And so that's what attracted me to Anthem. And it's because I believe Anthem's in the best position to improve healthcare.
Part of that background I noticed included 3 years with Healthways Hawaii. So I'm just curious, are people in Hawaii healthier than in most other places in the U.S.? We know about the sun and the beach and the water and everything, but talk about Hawaii a little bit.
Yeah, it's a beautiful place. And the weather, as you mentioned, Tom, the weather and the natural beauty alone provide enough reason to keep people active. But the other areas that I discovered of strength for Hawaii are strong social support systems, the gratitude they have for life, and their generosity. Their physical activity is just part of the time they spend every day outdoors. But they do have health disparities, and we certainly have they're faced with much of the chronic disease that we face in Indiana. And then also mental health is of concern. And specifically from a social concern is homelessness.
So challenges everywhere. Let's bring it back closer to Anthem and the industry as a whole. As you look at it today, what are some of those challenges, some things you're focused on? And as you said, making Anthem an even bigger player in the world of healthcare, not just health insurance.
Yeah, I would say that the proactive preventative care versus sick care that I mentioned that was part of my background is also something that Anthem is doing, as well as addressing the affordability of healthcare. In 2020, the cost of healthcare for a family of four was around $29,000. And the RAND study specifically showed that in Indiana, that we have some of the highest hospital prices in the country. So this is an economic issue that makes it hard to do business, to grow business in Indiana. And as there's less hiring and less money for raises to give to workers.
Well, that
And it
cost.
also, no, I was going to say, and also, making healthcare more consumer friendly, making sure that we have the digital tools that help facilitate healthcare decision making, and also provide the information when a consumer needs it.
Beth, two follow-ups there, two great things. You mentioned the cost, and then again, I guess I'll give some of my Indiana history here, having been at the chamber now 23 years. These are things we've heard 23 years ago, whether it was the General Motors or the other companies saying that those costs in Indiana were higher than in the other states that they operated in. That seems to be that nut that's very hard to crack. And that's one. I'll let you talk about that a little bit if you would.
Yeah, that does. It requires change, and it requires all stakeholders come to the table to look at how we can do things differently.
And regarding making the consumer friendly, again, another topic that we've certainly been talked about. There have been steps taken. How far do you think we are on that journey, and what are maybe some of the next steps that need to be done to make consumers more informed?
Yeah, I would say this has been the silver lining of COVID is that, we have all moved to modes that maybe we didn't use in the past in order to get things done in an effective and efficient manner. And so many of the digital tools are much more accepted. And we've, managed to change things where we can have interactions in new ways more quickly than we did in the past.
Beth, do you see individuals becoming better at either shopping around, using tools at Anthem, using tools that the hospitals have, of doing those price comparisons? How far along are we making progress in that area?
I would definitely say that there's at least an awareness, and that they're beginning to ask questions and have the conversation. And I think Anthem takes that responsibility serious. And so as you see more from us, even in the coming year, around the digital tools that we're bringing to our members to help make that healthcare consumer experience more friendly and easier to have access.
So we talked about something a little bit about the costs, but we also have challenges in our outcomes. In the Chamber's Indiana Vision 2025 plan, we look at we consider healthcare to be part of the attractive business climate for Indiana, and whether it's the smoking, too much obesity, which leads to too much diabetes and other conditions. It's not a new story, but one that's really difficult to change. Talk again about that role of Anthem and working with many, many others in trying to write a different story for that.
Yeah, I would, since our headquarters are here in Indianapolis and we do have 5,000 associates here, understanding and taking care of our environment. And what I mean by that is our health needs, a holistic approach to health. It takes on really a dual role for Anthem and ties back to my approach that I described earlier. For example, with Indiana Fever Partnership, working with Eli Lilly's endowment, as well as IU's University School, to develop leaders and a platform for athletes to be advocates for change. Also, we have many community-focused partnerships with terrific partners such as Gleaners to improve food insecurity, and LISC to address the underserved and to sometimes address overlooked neighborhoods.
Well, you gave me a chance to tease an upcoming episode. We're actually going to sit down with Allison Barber soon, talk about a little bit about your partnership, Fever, Anthem, with the Lilly School, everything that's being done to kind of empower the Fever players and management to be active and effective in the community. That sounds like a great partnership.
It is. And Allison's a great individual. I really admired. She was one of my first friends as I moved to town and was kind enough to host my husband and I for dinner. And, just getting to know her and her husband's energy for Indianapolis and what she wants to see happen is fabulous. And you can't help but be energized and excited.
All right, I'm going to jump. I'm going to jump to that Southern hospitality part that you mentioned. So the first time we had an opportunity to connect was in I think October of last year. You were recording some opening comments in relation to Anthem's title sponsorship of the Chamber's annual awards program. You were in your kitchen in Mississippi at that time during those comments. And now in your background, I'll share with the listeners. You're a graduate of Southern Mississippi, sometimes known as that school where that one quarterback went to. What was his name? He played in Green Bay for a few
Might
years.
be Brett.
Yeah, Brett something. Yeah. You've got your master's degree from Alabama, Birmingham. In other words, some deep Southern roots. Talk about again, and you've worked, as we mentioned, in locations around the country, but talk about your adjustment. You're still have your home in Mississippi, getting ready to transition full time to Indiana, as I understand.
Yeah, so we have acquired a home in Indianapolis, and we moved there at the end of last year, and have really been enjoying, but the hot market and finding just the right home, and we found that and are renovating that now. And one of the comparisons, Mississippi is where my husband and I grew up, and as we've always lived away, our family is in Mississippi. And another connection that you didn't mention, but I wanted to call out, is there's a connection between Indy and Laurel around HGTV. So we have the hometown show with Aaron and Ben Napier, and Indy has Good Bones. Yes. So, one of the things we also enjoy is we love older homes and remodeling older homes. And then as far as, just the adjustment to Indy, my most favorite thing to do is to go for a walk in the evening with my husband and dogs and to see a sunset. I realize that some days that's challenging, but I understand that in places like Brown County, and I've also heard things about the dunes near Lake Michigan, that there's some incredible sunsets to see there. So I'm excited to get the chance to tour around Indiana.
Well, while we're on, great. A lot of opportunities to discover. So we said you've been many places. What's on your wish list? Is there some place for a visit, a vacation that you've not been that kind of tops your list?
Yeah, well, outside of the Indiana Dunes National Park that we just talked about, in that lakeshore area, as far as abroad, Iceland, I still have not seen the Northern Lights, and look forward to seeing that as travel opens back up in a bigger way.
Yeah, my family, my brother and sister, we all had a trip planned there for last year, which obviously went away and with COVID and everything. But that one's high on our list too.
Yeah, I hear September starts the good month to see the Northern Lights. So maybe I'll see you there, Tom.
Well, let's get back to business for a minute. Some partnerships between the Chamber and Anthem. We've teamed together for 17 years on the Chamber Care program to help small businesses and their employees. We work together, the Wellness Council of Indiana, part of the Chamber, and Anthem. So I mentioned those not to get into the details of the programs, but just the importance of partnerships. And what's your approach when you look at teaming with others? What makes a successful partnership compared to one that maybe sounds good on paper, but doesn't actually maybe play out as planned?
Yeah, I would say, for 15 years that I spent in Nashville, 3 in Hawaii, Manhattan, and even my international work, it's just that common thread of wanting to see innovation and change happen, and change that improves the health of humanity. And so with that, I would say specifically in Indiana, we are the largest provider in the state, provider network in the state, which means we partner with hundreds of hospitals and thousands of physicians every day to improve the health of Hoosiers and make healthcare more affordable. And I would say that, we partner best when health systems that are forward-looking and innovative come to the table and say, hey, fee for service is not sustainable. Let's look at other ways that we can collaborate on maybe payment for value. And so when you see those mindsets, you know that anything can be achieved with that type of partnership.
I know it's been a short time with you and your role here in Indiana, but are you seeing that innovation here? Is your team telling you that, hey, look what's going on here, or look at this relationship we have?
Yeah, again, 2020 has, changed all things, and even relationships that have been challenged in the past have, come to the table, and we're having new conversations. So I'm excited for what that will bring.
Well, Beth, another area I mentioned briefly, the Wellness Council and its Indiana Workforce Recovery Program focused the last 3 years on areas of primarily substance abuse, but also now mental health. Again, and important to Anthem. Talk about how the company can lead in areas along those lines.
Yeah, and we were super pleased, Tom, to partner with the chamber in recent years, and I was excited to take part with you a little earlier this year. But we feel, that we do have a key role in helping to address the opioid issue in the workplace, and we also feel like that the chamber's involvement on this issue is key to our success. And as you know, Indiana providers wrote 66 opioid prescriptions for every 100 people. That's what the statistic we used in our earlier work, which is much higher than the US rate. So as far as the responsibility of how we work differently, we feel like by partnering with our network of healthcare providers in Indiana, that we've been able to reduce that number of opioid prescriptions and actually increase the number of Anthem members who receive both drug therapy and counseling treatment, which is recognized as the best practice to combat opioid addiction.
Beth, I think in recent years, I've certainly seen from a bit of the external view that employers are more engaged and they understand the importance of the workplace in the health of their employees. But if you're going to kind of offer some guidance, offer some tips to employers, what are some things you would say of the importance and certain steps they can do to kind of start this conversation?
Yeah, I think part of it is just understanding your environment, understanding what the needs are, and listening to your colleagues, your associates, and then education and information and getting them connected to the right resources and leveraging your partners to help do that.
All right, Beth, there's a lot going on, obviously, in Washington that impacts in healthcare and certainly the insurance industry. That landscape's changing, a lot of competition, seemingly a likely outcome. Can you talk a little bit more about some of the factors taking place and maybe opportunities that arise out of what's going on?
Yeah, and I think there's some real positives. So certainly there's a growing consumer voice and an aging population. And of course, affordability of healthcare as well as behavioral health are the top of mind issues. And so we've gotten some great opportunities through even thinking through like the delivery of our care system and its evolution. So shifting to virtual and moving more things to home-based care, and the need for that integration with that digital ecosystem that we talked about earlier, that's going to remain vital for us to be successful. And of course, health reform is always a top political priority with implications to our business. For example, changes that ushered in by the Affordable Care Act nearly 10 years ago are still being interpreted with some uncertainty, as has been challenged all the way up to the Supreme Court. And so why that matters to us in Indiana is that if and when a small employer are required to adopt an ACA compliant plan, what insurance coverage is required. And then ultimately, we have to stay focused on transforming Anthem from a health insurance company to a health focused company and helping our members stay healthy. And so we serve more than 3 million consumers in Indiana, and that's a tremendous responsibility. And so we'll keep that affordability and access top of mind. And then we also want to remain the most trusted choice for health insurance in Indiana as well.
You've mentioned it several times, Beth, but how often do the members of your team hear the term health focused? I assume that's just a key component that continues to be emphasized going forward.
Absolutely. And that is the focus. If to improve the health of humanity, it's imperative that we keep that at top of mind.
So we've talked, unfortunately, we always talk about challenges, but again, let's switch it to opportunities. What are some of the positives you're seeing? Some of the things that energize you as to, hey, we're on the right track, whether it's specifically Anthem's role or maybe even more general in the healthcare field.
Yeah, I just think that, beginning to make the healthy choice, the easy choice for our associates, for our members, for our communities. I think that's critical to our success. And then keeping that kind of proactive preventative care mindset. And I've seen a lot of that, just people working together in new ways. We've had outreaches with my brief tenure. We've had outreaches from, businesses, from different groups who are wanting to move things forward in Indiana. So I love the partnership of the business, the government, the chamber. I love seeing the innovation that comes from that. And I'm excited to be a part of it.
Yeah, you mentioned some of the digital delivery, whether the telemedicine or other things that have certainly gained more exposure in the past year. Do you think that also applies maybe to that preventive care in a positive way, that people are going to be more proactive, going to reach out, going to get that annual checkup or things just to be safer for themselves, which obviously will benefit everybody?
Yeah. And I just think, we were so used to a brick and mortar type setup that, now looking, going to your phone, going to the Sydney app for Anthem, going to find information in a new place, that's not going to be uncommon. We've learned how to do that through 2020, and much of the benefits of those learnings we can use and apply as we move forward.
Couple final questions. You mentioned earlier some of the fun opportunities, hopefully, as you get to travel around Indiana and see some of the different parts of the state. Talk about it from a business perspective. Again, when you're here full time and the team's moving forward, about how Anthem is reaching out across the state and doing so much.
Yeah, I think that, as I've got to get out and have some external meetings now that the weather is warmed up, I think that just getting to understand the communities and the unique needs of the communities is one of the most important things I can do in my role. And then making sure that our business model supports those needs.
Yeah, that is one of the always typical approaches, isn't it? To come in a position such as yours, to go out and do so-called listening tour. I'm sure you've been doing a lot of listening by Zoom and other things, but sometimes you can't replace that face-to-face.
Absolutely. And even as I think about, I've traveled to places like Vincennes, Indiana. I was able to have a meeting there early in my tenure, and some of the different areas you can't see that via a Zoom. So it's really helpful to understand what needs we have in rural care, as well as our, more populous areas. So I'm excited to discover all things Indiana.
All right, so here I'm going to appoint you the healthcare czar for a day. How's that? I have the power of doing that in these conversations, but if you could snap your fingers or decree one thing about healthcare and the insurance industry to help improve those outcomes and make people healthier, well, what's the one thing that you would like to see done that would make tremendous progress in that regard?
Yeah, I'll go back to what I said a little earlier around making the healthy choice the easy choice. So, how do we help someone have a healthy lifestyle that allows them to not suffer from comorbidities as they age? How do we help those individuals guide that way? So that would be my dream, is to allow that healthy choice to be the easy choice for our members.
And everybody.
And our community. That's right.
Yeah,
that's right.
All right, Beth, at the end of the day, whether we think about this either professionally or certainly personally, with your broad experience, the work you do, but at the end of the day, what's made it a great day for Beth Keyser? What can you, before your head hits the pillow, what has you thinking, wow, this has been a really good day?
Yeah, I would say part of the reason I love sunsets is for that time of reflection of what came, of the good that came out of the day. And so while there were a lot of challenges in my first 10 months of learning a business and learning that business remotely via Zoom or via a team meeting, I would say the positives out of that was seeing the willingness that people had around helping populations stay well, helping see people through this pandemic, and to improve the lives of our communities, as well as just seeing a good response and a return for businesses after COVID.
And as we talked, I know we talked before we started this conversation, the importance of revitalizing our communities, whether it's downtown Indianapolis or certainly other areas around the state. We all look forward to that activity, to that buzz returning.
Absolutely. And it's been good, has warmed my heart to see families out in the evenings with, their children riding the bikes now that the weather has improved, being able to be outdoors and, at least as a family unit being out. So that's warmed my heart. And I've enjoyed the Monon Trail and some of the many other delights that Indianapolis has to offer for exercise. So I'm excited to learn more of those locations.
Well, Beth, thank you so much for partnering with the Chamber, for coming into Anthem and your leadership role. And we look forward to bigger and better things to come as we work together.
Well, thank you, Tom. I appreciate your partnership.
All right. We've just heard from Beth Keyser, president of Anthem Blue Cross and Blue Shield of Indiana, in her role since July of last year. And we'll be hearing much more in the future from Anthem. Just a few quick reminders before we wrap up. We are releasing this episode 2 days before the 16th annual Best Places to Work in Indiana program. That May 6th luncheon for this year will honor 125 companies for their outstanding workplace cultures. We're also in the midst of returning some in-person training programs at the Indiana Chamber. We have some safety programs in place in early May and continuing throughout the month. Every safe social distancing and all safety protocols in place for those with limited attendance in our conference center. You can learn more about them at indianachamber.com/conferences. We thank you as always for listening to the In Chamber. We'll be back with your next episode in 2 weeks.